Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Bowel obstruction. So first let's look into the small bowel and the large bowel obstruction. So this is differentiated by the valvulus and also the ostrations. So they can be supine and it is erect. X-ray is taken and there's multiple air fluid levels which are seen. There is in small bowel obstruction there can be a stepladder pattern. The string of pearl sign is seen. The air fluid level is greater than 3 is the air fluid levels. Greater than 3 centimeters will be dilated. The greater than 3 centimeters SMO. Greater than 6 centimeters is the cecum obstruction. The cecum obstruction. Then we look into the large bowel. The large bowel, it is incomplete. Large bowel is incomplete. That is, ostrations is more in the periphery. Ostrations is more in the periphery. Next is looking at the small bowel. It is complete. That is, the valvulae convenes more in the center. So valvulus, it is more in the center. To learn and grow daily like this, please do subscribe.